Wow! Huples cat. Just want to talk about how my voluntary self-quarantining for NCOV 2019 is going. It's going okay, but I made a few errors and I just thought I'd pass them along because it might help you guys and girls out there if you're actually facing a situation where there's much more of this virus in your local community. So first off, me and Kitty, we work at a big major trauma hospital in Toronto. So we've already had NCOV patients diagnosed, and we've been in reasonably close proximity to them, and we're definitely in reasonably close proximity to nursing staff and medical staff, cleaning staff and portering staff that have also been in close quarantine with those people. And we are not at this time quarantining staff who nurse or look after NCOV 2019 people. Wear a mask, wash your hands, and you can just look after anybody else that shift. Interesting. The nursing staff are actually trying to do self-quarantining and limit the exposure away from pregnant staff and all of those things, but it isn't institutionally supported, which I always find interesting. But anyways, so what have I not done right? One of the things I haven't done right is I had an old red and white Ontario health card, and my doctor retired 4 months ago, and I've been sitting around thinking, oh, maybe I should go and get a new doctor. Anyway, it turns out I can't get a new doctor without the green and white photograph card that expires every 5 years. So I had to go and get one yesterday, so I've ordered it. So you really should have a family doctor, especially in a country like Canada that's progressive and has free healthcare. I mean, there's no particular reason why, other than being lazy and apathetic, that I allowed my doctor to retire and didn't do anything about it at the time. Obviously, if you have to buy a doctor, it's a bit of a different thing. The other problem, of course, is if you're buying doctor services and the doctors decide not to see you because they're frightened of you, they will be able to do that. Whereas in Canada, they won't actually be able to do that. Though judging by SARS, they will try hard. I actually got my old family doctor during SARS, and it was quite amusing because when I went there, the nurse who was doing my weight and all the rest of it said, oh, where do you work? I said, oh, I'm a nurse, right? She goes, oh, where do you work? As I said, oh, Toronto General. She sort of took a step back. She goes, oh, where in Toronto General? I said, oh, in the ICU. So it was kind of funny, but she was cool about it. But the level of fear in healthcare professionals about anything like this is really extreme, so don't be surprised if it's extreme in the population. Obviously, when we lined up, we used social distancing, we were very cautious about washing hands, all of that sort of thing. But it's really hard, if it is airborne, to actually be in any sort of confined space with people who are infected and not get infected, even if you're wearing masks, which we did not. I don't consider the community outbreak here to be big enough for me to take that risk at the moment. Obviously, if we have masks on us, and if somebody's actually coughing, then we would deal with it. And I do need to shave more often and keep my ability to put an N95 mask on properly at home if somebody bangs on the door and I have to open it, because that's something I haven't been doing. I've been a bit lazy on that, so I have to work on that. The other thing I haven't really done, I haven't really gone out and done any major buying of food. I'm considering doing that probably after nights this weekend. We'll probably go to do a Costco run when it's not very full and load up on bread and a few other bits and pieces like tinned fruit and stuff like that. Stuff we wouldn't normally use, but it's nice to have a nice stock on hand if we end up having a Wuhan City event here in the next 2 to 4 to 6 weeks. It's always a good idea not to have to rush out and panic buy. There's been a lot of panic buying going on around the world. I mean, yes, I have prepper stocks in a large pantry and I have some stuff, but the truth of it is things like canned pineapple and canned oranges and canned pears and canned peaches don't really last very long in tins, so I don't really have a reliable supply. So this is a good time for me to go and spend a couple $100 and actually boost that up. Now, I actually have a $1,000 credit on my Shoppers Drug Mart Optima card, so I'm actually going to use that in No Frills, which is a grocery store, and have a really kind of a heavy stock up for this, I think. I think it's important, and again, like I say, we'll time it so there's not many people around. We're very careful with hand washing. But remember, the tins and containers you get are also likely to be infected. So you do need to at least wash down most of these things with at least soap and water with a little bit of bleach in it. And remember, when you're out decontaminating containers like tins and stuff like that, use gloves, use a gown, and wear a mask. You can make it aerosol, you can make it airborne whilst you're cleaning, right? I think that's a lot of things people don't realise. Everybody's rushing out there and buying all of these bleaches and all the rest of it. When you are cleaning something that's potentially contaminated, the cleaning process puts you at risk from inhalation. So make sure you're actually taking it pretty seriously. If you are cleaning something you think is contaminated, treat it like a contaminated person. I don't think that's something that most people out there who are not in healthcare are aware of. I know a lot of nurses aren't aware of that. I'll happily see them scrubbing away stuff without any mask and without washing their hands afterwards. And it always makes me go, what are you trying to remove from that computer desk and where's it gone? The other thing I haven't done particularly well is I haven't reorganised my life to a major event. We've stopped going out and stuff like that, but what we had done, we had the painting done that we planned to do. We just decided not to reschedule that. Again, normalcy bias is huge, and you've got to be really kind of careful. When you are in the point where you are going to put wood up on your windows, which I don't advise you ever to do, because you might be trapped in there and burned to death, but when you're in that kind of physical and mental state where you're absolutely locking down, it's probably too late for an infection. Like I've tried to tell people, the infection will be out in the community for 2 to 4 weeks. Specifically this type of an infection, it seems to have a long infection period without symptoms. So if it is 14 days, if it is 10 days, even if it's 7 days, there's a lot of people out there with it, passing it along, doing their daily lives, feeling just fine. So that's kind of an issue. Now people die, it's just the way it is. One of the things we haven't done is make wills. We've been very lazy on that. And that's something, once this is over, we're going to have to address. Because frankly, it's not really fair on your loved ones to die with a whole bunch of money all over the place, and in fact, in my case, all over the world, and not actually give them really good clues as to where it is. They also need to be able to get it, right? And it's a lot easier if you've made a will for people to get your assets than not. Now, why am I talking about death? Well, I work in healthcare, and people are going to die in a pandemic. I'm going to put some slides up showing you the relative death rates because of Spanish flu as far as they could tell back in 1918, 1919. The truth of it is most people will not die from nCoV 2019. Most people. It's going to be hard to get it. I'm still seeing videos out there. Raven Tactical did one recently where he claims that only old and sick people get this flu. That is debunked. That is not true. Everybody can get it, and the younger you are, the healthier you are, it seems the more likely you are to get very sick and die. That's opinion. I'm certainly seeing that from people I know who are in Wuhan, who report who in their families get sick, which is pretty much everybody, and who's actually getting really ill from it. And it's mostly the 20 to 30, 40-year-old males and females with a few children that are getting very, very sick from it. Now, obviously, if you've got COPD or if you've got lung cancer or whatever, you're in chemotherapy, you get this, you're probably going to check out. Now that brings me to the next video I'm going to do, which is actually healthcare. The healthcare implications from this are absolutely massive, and I just want to give people a rundown of that. From my perspective as an ICU RN who now runs a hospital at night that's pretty large in a major city, what I think will happen, what I think could happen. And those two things I think are important to talk about and think about, not to spread fear porn, but to actually get mentally geared up to actually be able to react proactively to events rather than react to events. I think that's really important. That's why I prep. I prep so I've got some plan, some ability to mitigate and react to events as they occur, rather than just trying to cope with them as they unfold. Does that make sense? So I'd say my big failure is to convince Kitty to really clamp down on quarantine. Right now she's off at yoga, and she is doing things smart at yoga, like she's not in the changing rooms and she's keeping distance and all of that stuff. But again, if somebody's in yoga and they're coughing out viruses, or they're just breathing out viruses, or they're touching things, she's at high risk in that sort of environment. And I don't think it's particularly smart or safe to do that right now. But people are people, and lots of people are going to do that. The other thing I think is I would want to talk about the lack of information that's available. A lot of people are basing their pandemic planning on their own biases and YouTube videos done by people who have no scientific training. And while that's appropriate for scenario building, for planning, for gaming out possible situations. This is SHTF. This is a pandemic SHTF that is unfolding. So to continue to get information from people who have no educational background in health sciences, or people who have no scientific background whatsoever, who are merely going through news reports, breaking news, and doing a video for an hour while they go on about whatever they think you should do, isn't really productive. It's certainly not helpful. For example, the weaponized coronavirus stuff is still going on when it's long since been debunked. They're still linking it to the Canadian labs and all of that stuff. They're still linking it to Bill Gates. It absolutely is not true. This is a naturally evolving virus, right? It is. Get over yourselves. But the other question I always ask these people is, what's the difference? Okay? You obviously don't know what a bioterrorist weapon would look like. This is a pretty useless one. It doesn't have enough death rate. It does have a long latency period, and we don't know about the infection rate, but it really hasn't got a great death rate if you were designing a bioweapon. I'm also hearing over and over that this has been made from the HIV virus, again linking two separate issues in one. Now, the other thing I've done badly is I have a reasonably large stock of Tamiflu, and I specifically have that stock for this sort of a scenario, and I haven't actually used it. And one of the things I'm intrigued about is nobody's mentioning Tamiflu, and I don't recommend it without a medical prescription. I actually don't recommend it, even in SHTF, without a medical prescription or severely strong reasons and knowledge. It can cause serious, including death, adverse effects, specifically in young people. So I don't recommend Tamiflu. I'm kind of intrigued as to why there's no mention of it at all on the press or in the scientific reports. So that's something I'll do tonight if I have time, is I'm going to try and figure out why Tamiflu, which was the big saviour in the past, seems to have been ignored. Is it because it doesn't work and it's been tried, or is it because there's not enough stock, so there's no point bringing it to people's attention? I have my stock, so I am considering, if things get quite bad at work, putting Kitty and myself on it. We're not really at the age risk group for that, so that would be something smart we could do. I think it's a little early yet, but who knows, right? Now, I've mentioned it before, one of my major errors was I sent all my pandemic stocks to the Shire, which is a house we're having built in the country, miles from anywhere, which looks like it's going to come online 6 months too late for this particular SHTF. But I literally sent almost all my pandemic supplies there. So I'm in a fortunate position. I was able to restock to quite a large degree the stuff I would need in a pandemic, and I have done a video on what you should do if you don't have medical grade equipment and you feel the need to wear personal protective equipment. Again, try to avoid having to wear it. If you have it in your home and somebody's sick, you must wear it, and if you're going out and about in the community in a large infection, you should probably wear it. So yeah, that's basically one of the things I did. Was you have a complacency when you prep. You have lots of preps, you put them, you store them, you look at them, they give you pleasure because of what you have, but then you make decisions based upon life, and you end up being actually separated from all of my N95 masks. What a dopey thing to do that was. I didn't expect there to be a pandemic, but realistically pandemics do tend to strike in the early part of the year rather than the October, November. That isn't always true, but that's what it seems to be. Now, this one's not actually a prepping failure for the pandemic from me, but I think it's a massive failure of most people online who are talking about coronavirus like they know what they're talking about. I think it's a massive failing of Ontario healthcare. Nobody is expecting more than one wave. They're treating this like seasonal flu. It comes and it basically stays. This is a pandemic. Pandemics have waves. It may only have this wave. It may have 1 more, 2 more, 3 more, 4 more, even 5 more waves for the rest of this year. It might even reappear next year. Nobody knows, and nobody will know until time has passed and time shows us the reality. But I think it's prudent as a prepper for you guys to take on board right now that in 6 to 8 weeks there could be a second wave. The second wave could be stronger than this wave. Could be a lot weaker. We don't know. Just because it's the first wave doesn't mean it's the strongest wave. Just because it's the third wave doesn't mean it's the weakest wave. It doesn't work like that. The virus is slightly mutating via contact with people. We're a host for this virus, okay? It's jumped from animals, lots of speculation which animal. It's kind of meaningless. People shouldn't be eating meat anyway, and they should all be vegan, and we should all be driving Priuses. But that's not the world we live in, and it's certainly not the world China lives in. So in reality, it's fine to prepare for this and keep a very close eye on this, but keep at the back of your mind, this could come back in 8 to 6 weeks, and it could be a lot worse. So keep that in mind. Doesn't mean it will come back, doesn't mean it will be worse, but keep that on mind. This is a pandemic. Why the World Health Organization hasn't announced it is basically because they're waiting for a large-scale transmission in a community outside of China. Not quite sure why they're waiting that long. China's a massive country. There's large-scale transmission in various parts of China. That's enough to call this a pandemic, specifically because there's also non-Chinese transmission occurring now in other parts of the world. So it is a pandemic. They're going to call it a pandemic when they need to. They're trying to limit the economic costs. The economic costs will be in the trillions from this. Car manufacturing, lots of manufacturing is stopping. Very soon, and West, you will start to see layoffs in a lot of industries, and a lot of entertainment stuff will shut down. They're now talking about closing, ending the Tokyo Olympics. There's been a lot of major world trade shows and events cancelled that are due to happen in March. The other prepping failure, and it's not mine, is that with these men, and they're mostly men on the line who are actually parroting stuff they're reading in mainstream media or on extreme websites as truth and then embellishing in that, is they're not actually following the stuff they should be following. And by that what I mean is, what's the official government's up to? Well, you know, England just announced today, with great fanfare, that they've actually now able to test 1,000 people a day for the coronavirus in England. They've increased the amount of testing, they've increased the efficiency of the testing, and that's great. But those are the sort of indicators I look for to suggest to me that they're thinking they might have to test 1,000 people a day. Okay? Like when China built their 2 hospitals, they thought that would be enough because one was enough for SARS. They're not enough, they're still overrun. And that's the indicators you want to look at. How seriously are they quarantining? How many beds are they providing? What's going on? That's the information that actually gives you a clue as to what the people in charge of the various countries are expecting. Various things will give you clues that there are issues. The other thing that I think for me is a failure for me in this is I didn't take on board the fact that I spent months in voluntary severe quarantine, much more severe than I am right now, during SARS in 2003, and looked after about 40 odd patients with SARS wearing the full HEPA hood suits and all the rest of it. And I didn't appreciate the fact that that's still carrying an emotional burden for me and for Kitty. So this is bringing all of that right back to us. A lot of us are quite distressed in my hospital who've been through this before. Not because we're frightened of it or we don't want to go through it again, though both of those things are actually true, but because it's actually bringing out a whole bunch of stuff that we never dealt with. We were never offered counselling, we were never offered therapy, we were never followed up. Nobody ever sat down with us a couple of months after SARS and said, do you want to talk about it? What do you think happened? How do you feel now? How's it changed your life? None of that stuff happened because I guess nurses aren't that important. The thing is though, without nurses the healthcare system will completely collapse. So that's one of the other things I think a lot of preppers are not taking on board, is that they're watching all of these videos and all of this stuff about what we're doing right now for this virus, and they're not imagining what it might be like. And that's going to be the next video, effects on healthcare. Toodles, keep breathing, just don't breathe very loudly or very harshly around other people. Toodles. It's a Bad Terrier 2020 production.